What are the different ways you can do hormone replacement therapy? Well, you can do a lot of it through the skin, and that's actually the best way / most studied way to do it with the least amount of risks and side effects. So through the skin means transdermal. There are patches, there are creams, and then another way that's not really transdermal, but that does make it in through the mucous membranes is via troches or troches, depending on how you want to say it. But we do not want to replace estrogen orally, ideally. That does come with some increased risks. So we want to do it transdermally, and we can do, if we do it via a cream that comes from a compounded pharmacy, we can use a couple of different types of estrogen, and we can do whatever dose we want. So we can use estradiol and estriol in combination in different ratios. If we do a prescription patch, it is only estradiol and only comes in certain dosages, but there are a lot of doses available, so most women are able to use a patch totally just fine. And then when it comes to testosterone replacement, that really does have to be done either via a compounded cream or a troche. It does not really come in prescription over the counter, as in from a CVS or Walgreens, et cetera. We have to compound that. And then of course, progesterone is definitely best taken via oral. So it's oral micronized progesterone, and it comes in sustained release and immediate release, and it's best taken before bed.